Hi, Manong George here, and today we interview an infection control and prevention nurse here in the UK.
Are you ready to pass the NMC OSCE the first time as efficiently as possible? Then you're in the right place. Here at IELTS Medical, we've seen adult nurses through to a first-time OSCE pass ending last year with 98% first-time pass rate and 100% second. We've also assisted mental health nurses, children's nurses and midwives through their OSCE exams too. Accessible OSCE practice rooms and expert-led courses. Our nurses are not only passing their exams, but they're having fun doing it too. Inquire today about how we can assist you too.
As you can see, we are following coronavirus guidelines from the government. So our interviews are now based on teleconferences for the minute. Hi to our guest, Miss Mae Cometa. Would you kindly introduce yourself and tell us what you do?
Hi, I'm Mae Cometa. I'm one of the infection prevention and control nurse in one of the NHS hospitals here in the UK.
So, so May, what does an infection control nurse do?
Infection prevention and control nurses provide expert advice on the prevention of infection and healthcare associated infections. So we provide guidance and teachings and learnings on all members of staff in order to prevent healthcare associated infections. We are here to support and guide staff every day, and we help them understand how to prevent infections and any organisms that they might not have come across with or new to them.
Can you tell us your day-to-day activities and how does that compare now with the coronavirus pandemic?
So part of my role as an infection prevention and control nurse, aside from giving teachings and education to the new members of staff or for our staff in their inductions or mandatory training, is to make sure that at this critical stage, we provide them with the right teaching on, most importantly, the personal protective equipment. We make sure that all the members of staff are fit tested for an appropriate FFP3 mask. We remind them on how to don and doff PPEs to protect themselves and the patients. We make sure that they have trainings on how to respond to patients that are suspected of COVID-19. We make sure that they know what to do when they come across patients in A&E especially, because they are the first line of staff that will come across COVID-19 suspected patients.
That's right. Wow. So it's quite actually a very critical member of the multidisciplinary team, I suppose.
It is. As I've always said, infection prevention and control is everyone's responsibility. It doesn't just lie on the infection prevention and control nurse to prevent infection. As you know, or all of us know who works in the healthcare industry, every area or stage of the patient's timeline or journey, yes, that's right, George, every step or stage of a patient's journey, they come across an opportunity to have that infection prevention. May it be the chef who prepares the food, to the person who prepares the scrubs for the surgeon. So everyone has the responsibility to prevent infection, not just the nurses and not just the doctors.
Well done. Thank you for that. And do you have any advice for everyone? Obviously, right now in the age of social media, there can be good news, bad news, and even fake news. So what would be the suggestion of an infection control and prevention nurse to the people, especially those who are in the UK?
Exactly, George. You're on point. There are plenty of fake news out there. So for us working in the NHS and even I think in the private sectors, it's
Mhm.
very important to keep yourself updated. Go to gov.uk and you can read all the latest updates from Public Health England to learn about how to prevent or how to protect yourself against COVID-19. So, as an infection prevention and control nurse, I always advise people to make sure you know your personal protective equipment. You know how to use them so you can protect yourself and your patients. Do the 5 moments of hand hygiene. The World Health Organization have introduced that, and make sure you know when is the right moment to wash your hands, the time that matters most to you and to your patients. And also, I would like to encourage everyone to follow the government's advice of self isolation. It's
Mhm.
called protective self isolation. It's the time that we become serious in taking this, because this is a global health crisis and we must take responsibility for humanity's sake. And also social distancing. I think as humans, it's very hard for us to do this, I guess, because the challenge is we are social individuals, we are social beings. So it's very hard. However, we can do this because by doing so, we are protecting our loved ones and
Mhm.
not just ourselves and our patients.
Wow, well said. Thank
I just want to share this quote from you, something that I've read from an author named Viktor Frankl. He said that everything can be taken from us but one thing: the freedom to choose our attitude in any given set of circumstances, especially right now that we are facing a crisis that's basically asking us on where we should stand. So let's protect ourselves and protect the people that we care for and the people that we work for.
you very
Thank you.
much. And please, guys, remember to follow Miss May's suggestions. We only have one truth at the moment, and that is coming from the .gov.uk website. So please make sure you follow that. Also, if you have any questions, need any help, please join us in our community page, the Filipino UK Nurses Community Group. And we also have a website called www.filipinouknurse.com for any of your queries.
Always remember, Manong Dos.
Mom knows best, put your worries to rest when staying in the United Kingdom. Mom knows best.